recognizing the limitations. The balance is that you do as much good as you possibly can in a short period of time. We're only there for a week, 10 days. And I think that's the bang for the buck. The bang for the buck is how much good you can do in a short period of time.
You know, we're staying up late every night. The first night, I think there's one room that stayed until 11. The second night, 2 rooms until 10. And I asked at about 8 o'clock if people were tired and wanted to go home, and they all said they're tired, but they wanted to stay. So I think we are helping the maximum number. I think that's really the spirit when they come down here. Even though I get concerned that they're going to get tired and burn out, they're okay. Everybody's okay with that. That's the idea.
I see doctors really excited. They can just serve people. And I think, physicians, that's what they want to do. They're servants. They might be high-paid, fancy-pants servants, but they are nonetheless servants. They serve humanity. And I think when they get here and they see the real value of their skill in a humanitarian connotation, I think that that really inspires them. And I think that gets them really excited.
It's again, we went into it, all the guys who are in healthcare, went into it to help people. We sometimes lose sight of that, being here and getting involved with the business end of medicine. When you go down there and you're just purely doing that, you get reminded of what you really wanted to do.
Basically, there is already a long line of people standing there waiting for us. And so the people that are going to be doing triage immediately start doing triage to decide who's going to require surgery, who might just need a pediatric clinic visit, who might need an OB/GYN clinic visit, who might need a general medical clinic visit. So we sort of already start getting an idea of what might need to be surgical cases for Monday.
What's on the agenda today?
4 gallbladders and a couple of hernias and whatever else we can sneak in.
We got 3 vaginal hysterectomies, abdominal hysterectomy, and a tubal ligation.
I know we saw about 44 yesterday between the 3 doctors.
Apparently he was burnt when he was 2 years old in a house fire. A candle had lit his fallen, and he was bed had caught on fire, and there was nobody home to help him. So he's got pretty substantial burns with his face, his left upper extremity, both his hands, and both his feet as well.
She came from the local clinic, said she had a huge big fibroid on the uterus, and the plan was to do a myomectomy. And we went in there, and it turned out to be a huge mass on her left ovary. So we took out the mass itself, and we left the tube behind that side, so everything should be fine.
There's a lot of poor health in terms of poor nutrition, poor diet, poor prenatal health care. So you see a lot of congenital abnormalities. A kid that's born with a cleft lip, cleft palate is ostracized from society. Can't play with his other friends or kids, can't go to school. And so these kids are pretty much cared for only at home by their immediate family. And obviously it has a big impact on them because they realize that this is an opportunity for them to obviously receive help for a healthcare problem that they previously were unable to receive help for. I think you learn is that there's a lot that you can do in a week, even though you don't have all of the equipment and you don't have all of the supplies and you don't have as much things as you were normally used to working with. There's still a hell of a lot of good things you can do. There's a lot of good to be done and can be done.
The patients there are so much in need. I mean, you help so much more in 1 week than you do in a month here. Well, you feel like a real doctor down there. You actually feel like you're doing work, and every effort you have is helping people. And they're so grateful. Every single person you treat, they're grateful, they're so happy that you're there. It's an amazing experience. It makes you feel lighter when you're coming back. So I'm basically hooked. I cannot not go.